join me in welcoming Dr. Ronald Bush.
So, the question I had when back in 1994, I got really fed up because Hillary Clinton was actually the stimulus for the ambulatory vein centers, whether she knows it or not. It was Hillary Clinton, because she, as you remember, trying to start the national health insurance program, and she had all these people coming from all around, doctors, although I wasn't one of them, on the boards and the panels to decide how could we make healthcare affordable. And one of the doctors was a communist I knew of very well. He was a family practitioner around our area. I know he's a dedicated communist, so I figured that he's on the board, I wasn't going to have any chance. So I figured out what could I do as a vascular surgeon to get out of the hospital and actually, be a little bit independent of healthcare, and it was very limited. At that time, I said, okay, so I got to either be a genius to leave this, or I got to be mad, because when I was leaving my income, my source of what I did for 20 years before as a vascular and thoracic surgeon, and saying, okay, I'm going to do something different. So the options until 1994, you could have a vascular lab, which I did, and it was it was a supplemental income or a wound care center, but they weren't really. It was hard to really make a living just doing that. Okay, you still had to have hospital affiliation, which was the big problem I saw. I wanted to get out of the hospital. I was tired of the stupid committees and idiot doctors I had to deal with, and I just didn't want to do it anymore. It's like I wanted to be on my own. So I decided we're going to do a vein center. And this is a stripping in the office, invagination stripping using tumescent anesthetic. Tumescent was actually made possible surgery in the office for venous work. And tumescent, if you don't know what tumescent is, it's just dilute xylocaine mixed with saline, epinephrine. You can use up to about 3.5 liters, and usually for a vein practice, it's about 5 at the most for stripping, or for intravenous ablation. So we were able to do tumescent. We started, why we brought tumescent to the office was I started using tumescent in 1993 to do carotid endarterectomy. So I thought, well, heck, if I can do a carotid endarterectomy with tumescent, let me try it with a vein. So we actually mapped out the saphenous vein, injected tumescent anesthetic, made an incision. Then with Gabe Gordon's technique, what he's described in 1997, invagination stripping using the pin stripper, it was like, this is actual blood loss. It was actually revolutionary. You could do this. And so this actually been voted, it actually made the possibility for surgeons to actually do venous work in their office. And we used to train a lot of doctors on how to do this technique. Candy and I, we started our clinic in 1995, and we actually had doctors from all the country to come here and see us do this, as well as we would have seminars way back then describing how to do this technique. So in 1990, we could still do high ligations with or without stripping. So there were still some doctors said, you don't do stripping, you just do a high ligation, you just do a phlebectomy, which is all wrong. And sclerotherapy at that time still used liquid, okay? So we opened ours, and we had to have a paradigm shift in how we did stuff. And I put the red stuff in because it's the stuff I absolutely, it's hard for me to control, okay? I can do the treatment, but the business model, the ancillary personnel, everything was different. The equipment, medical equipment, supplies. I mean, we had to start, we didn't know what, for an outpatient vein center. We had to go in by day, figure, oh, we need this, oh, we need this, or something else we need. And the community wasn't aware of a vein center. So soon became evident that we had to merge business and medicine, which I don't like to do. I mean, all I want to do is just do my job, and maybe go out and run or do something else. I didn't like to run a business. I hate running a business. Nobody, physician-wise, knew anything about this new specialty. Okay, just nobody knew anything about it. It was a vein. They used to think a vein's a high ligation stripping in the hospital, strip it out, right back to home. So we were unknown to the general public. We can only rely on referrals in the area where we had our practice originally. Okay, it's the most offensive item I think in my vein practice is advertising. Okay, I know it's a necessity probably, but I wouldn't choose my physician based on a TV or radio ad. I keep telling Candy that, and for years, and she said, we have to do it, have to do it. It's a necessary evil. However, internet may be the salvation for us doctors, okay, as we do research. I think that a lot of our patients now come through the internet. They come find us on Vein Experts, they come find us at Midwest Vein. And it's good. I mean, we still have to advertise. We still do newspapers, radio, however. So we still do those. But more and more, I think the internet's going to be the primary. This is our internet here. And actually, this internet was not only for the patients to find doctors, but this is educate doctors. What I'm doing is on this website, I am actually, there's a part for patients and a part for physicians, but I'm actually imparting everything I've learned about venous disease over the last 15 years. In the next 3 years, it'll be on this website. Okay? That's my swan song for veins, because I am partnering with a great IR guy, and I'm working less and less. He's working more and more. I'm going to do more research now. So the root of all evil, of course, is money. The Bible says root of all evil, the love of money. Okay, so I'm a pretty evil person. But I don't have any money anymore because Obama's taken it away from me, so I don't have any. I guess I'm become pure. So we had to do cash, insurance, or credit. Okay, so these were the things. We never had this in our office. We just like, had insurance, you had this, and that was it. So now you had to have patients come to you, and you had to offer them something. You had to, so a whole new thought process. Billing and collecting, okay? And this is a business. You don't have to come see me, okay, for emergency or because you got something really, really wrong or something. You have to come see me because you like me, you like my staff. Now and now half our income is outside the parameters of insurance reimbursement, which is good. So this is good for physicians, whether you're doing this part-time or full-time, getting your own reimbursement is great. Because you don't have to worry, you don't have to rely on the insurance company. However, there's been an influx of physicians doing this now, okay? This is made possible by the lasers and the RF, which now you don't have to strip the vein, so anybody can do this. I mean, it's anybody with a little bit of technical skill can do an intravenous ablation. You don't have to be a surgeon now to take care of this atlas vein. So this opened up the avenue for all kinds of doctors to come in. It's very important that if we're going to do this, be serious. I think hopefully a lot of good ideas will come out of this. I'm interested in seeing what's said here, and thank you for your attention. Thanks.